talking about pre-implantation genetic screening, also called as PGS. I'm very sure many of the patients who are undergoing IVF, especially those patients who have had repeated IVF failures or patients with recurrent pregnancy losses, are often suggested to undergo this pre-implantation genetic screening of their embryos. So what are the advantages and who are the patients who actually require this PGS? So first, let's understand that embryo to have a successful implantation and subsequently have a successful live birth, it's important that the baby is made up of a normal genetic component. So there shouldn't be any deletions or translocations or abnormality in the genes which can result in either a negative pregnancy or can have abortions in the early trimester or have baby born with some congenital malformations. So to prevent all these things, in order to enhance the success rates of IVF and also to prevent the chances of abnormal babies, this PGS, that is pre-implantation genetic screening, offers an excellent tool to prevent such abnormalities. So how do we do this test? There are three types of tests in pre-implantation genetic tests. One is pre-implantation genetic screening of aneuploidies, that is, we just screen whether the overall genetic makeup of the baby is normal or not. PGTM, that is screening of particular disorders like monogenic disorders, be it thalassemia or a sickle cell trait or any particular abnormality which can run in families. The last one is called PGTSR, where it screens structural rearrangements in the patients, which we quite come across quite often. So generally PGS, that is pre-implantation genetic screening for aneuploidy, is done on embryos to determine whether the particular embryo is normal or not, so that a normal embryo can be selected and taken for transfer, so that the chance of pregnancies increases and also the chances of miscarriages come down. So is PGS done for all patients who are undergoing IVF? No. There are a selective subset of patients who require this PGS. So PGS is offered for all women who are advanced age, that is more than age of 40, those patients who are having repeated IVF failures, patients with repeated miscarriages, or patients who are having some familial disease where some disease is running in the family. So in order to prevent such disease from being transmitted to the next generation, this test can be offered. So how is this test performed? So after a conventional IVF stimulation and oocyte retrieval, the embryos, which will be done through an ICSI mode of fertilization, will be allowed to grow till blastocyst stage, that is day 5 embryos. So once the embryos reach a day 5, laser assisted hatching will be done, so that small biopsy of about 4 to 6 cells are obtained from the cells which are surrounding the embryo, that is called as trophectoderm cells. So these are the cells which subsequently form the placenta. So such cells are taken for biopsy, which is generally a reflection of the genetic makeup of the embryo. So once these cells are selected and sent for testing, we can determine whether the embryo is normal or not. So the embryos will be frozen and we will await the test results, which we get in about 2 to 3 weeks time. And once the test results are obtained, we can select a normal embryo and that embryo can be selected for transfer. So PGS is such a boon for all these patients, especially for those patients who are of advanced maternal and paternal age. All those patients who have had repeated IVF failures, which is likely because of aneuploidy of the embryos, will be benefited by this through PGS. So all these tests, PGS for aneuploidy screening, for monogenic disorders, for this structural rearrangement, all these tests are done in all our Milan centers. So talk to your fertility specialist today and see whether you are supposed to undergo PGS for a successful implantation and a successful live birth.